Hello, everyone. On behalf of the Biostatistics, Epidemiology, and Research Design Core of the Hispanic Alliance for Clinical and Translational Research, in collaboration with the Bioinformatics Core of the Alliance and Hispanics in Research Capability Endowment Program, I would like to welcome you to this informational webinar on Big Data Research Award Opportunity for the year 2023. This is a funding opportunity that we have long been doing since 2016 in collaboration, we meaning the Hispanic Alliance for Clinical and Translational Research in collaboration with the HiREC program, which is the Hispanics in Research Capability Endowment Program. And as I mentioned, we started this funding opportunity back in 2016 in collaboration with HiREC, and our first awardee was Dr. Karen Ortiz. And in her research project, she looked into the use of adjuvant therapy among stage 3 colon cancer patients in Puerto Rico Central Cancer Registry and linked it with the health insurance database to explore her project. In 2018, we had two awardees, Dr. Dagmar Hernandez and Dr. Angel Mayor. Dr. Hernandez used a special database on healthcare costs and utilization projects, the national data to explore the racial ethnic disparities in healthcare utilization in patients who were undergoing transcatheter aortic valve replacement. Dr. Mayor, he used the data from Retrovirus Center in UCC for his project to explore the incidence trends in HIV patients. In 2021, we had one project shared by two principal investigators, Dr. Darlene Santiago and Dr. Jonathan Hernandez, who looked into the National Survey database on drug use, and they explored the substance use disorders in older Hispanics, adult Hispanics. In 2022, we have a project currently in progress, and the awardee is Dr. Polaris Gonzalez. She will be using the N3C data set, the National COVID Cohort Collaborative data set, to look into the effect of COVID-19 infection during pregnancy among the Latinx Hispanic mothers, to look into the birth outcomes from these pregnancies. And in 2023, we have this announcement, and it's somewhat different because now we have a new collaboration with the Alliance BBEC Core, which is the bioinformatics core of our alliance, as well as we encourage collaborations, and we already established a collaboration with Axel CTR at the University of Delaware to announce this new funding opportunity. So this year, there's something even more interesting because we will be having two project categories. One category is for projects that will be using N3C database. As I mentioned, that's the database that's currently in use for the current project awardee, or small grant awardee. And that's, if you need more information on our website for the Hispanic Alliance for Clinical and Translational Research, you can find a promotional webinar that we organized to introduce that database to our researchers. If you have questions about this database, you can also approach us or BBEC Core leader, Dr. Mary Helen Mays, to get an introduction to this database. So that will be one of the project categories. And the other projects will be utilizing any other pre-existing large database. Examples of those you see listed below: All of Us, Health Costs and Utilization Project database that was used by Dr. Hernandez. cancer registry, and other databases that are applicable to your research question. So in order to apply for this funding opportunity, you should come up with a plan, a project that conducts analysis, and you don't have to collect new data. Actually, we discourage collection of new data. We are focusing on pre-existing databases. So as a result of this analysis, you should present your results for, let's say, external funding, submitted as preliminary results for application for external funding, and or you publish your data as a manuscript or a policy paper or something like that. The important thing is that because you don't have data collection involved, you only focus on the analysis and the presentation of it. It's a short-term project. It has to be completed within 12 calendar months. To qualify for this funding opportunity, at least one of the PIs should have a completed doctoral degree. Some other PIs, co-PIs, could be doctoral candidates. Yeah, as I mentioned, it's about statistical analysis, but it's worth mentioning that it has to be new statistical analysis. It cannot be something that you've already completed and you're looking for funds to publish the results. So during the award period, you should explore the data set for a new research analysis, a new research question, and present your results. The database, to qualify, we also look at the database, and it has to be a large collection of data. It could be structured or unstructured, but it should be on local or national level. It cannot be just data collected from 1 or 2 clinics locally. Another new twist that we added this year is the collaboration. So we encourage our applicants for this small grant opportunity to include collaborations with other centers, clinical and translational research centers. So the Hispanic Alliance for Clinical and Translational Research belongs to a network that's called IDEA CTRs. Let me switch to show you the map and the list, and you can easily just explore the name IDEA CTR in any search engine, and you will find the link to the IDEA network, ctrnet.org, where you have various centers that are all over the United States. And in Puerto Rico, this is our Hispanic Alliance for Clinical and Translational Research. So we encourage you to find collaborators, and we also can help you with that. So when you apply or you're thinking of applying, you can contact us and say, I have this research idea, I'm going to use this database, and I would like to find a collaborator from IDEA CTRs. And it could be, and most likely it will be a senior researcher in one of these centers who can help you in writing up this grant opportunity, as well as the application form itself, as well as during the whole project. They can help you to develop it, the analysis, and present it appropriately. So if you need collaborators, please let us know in advance, and we can circulate your research idea, the write-up of the research aims, and preliminary write-up of the approach, and see if we can find a senior researcher collaborator for you. We also encourage collaborations within the Alliance institutions. The Alliance itself is including UPR Medical Sciences campus researchers, Ponce Health Sciences University, and UCC, Central Caribbean University. And of course, HiREC is also an endowment program between 2 medical sciences campus schools, School of Medicine and School of Health Professionals. So in terms of budget, we can allocate the funds to to reimburse you for your travel expenses. For example, you're planning to present the results in a conference, so we can reimburse those. For publication costs, we all know it's quite expensive to publish these days. You can purchase a computer if you're in need of one, or statistical software. In the past, for example, we have also paid for database access. Most of the databases are public databases. However, some of them do have a fee to access them, so that money can be used for that as well. And also, for example, if you need a consultant or data analyst to actually write the statistical program and do the analysis, our budget, the budget can also include those expenses. So the application form that we have, and I will show you the link at the end of this presentation. So the application form is quite simple and it's very short. Don't think of it as a big, grant application form. One page specific aims, which should include the current gap in the current literature, in the knowledge for the field that you're studying, for the research question you're studying, the goals, specific aims and hypotheses, the expected outcomes, and what do you expect it to be the impact on the research field. We will need for you to upload the bio sketches in IH format. The latest format link is here for the PI and the co-PIs. Of course, you have to mention who you're collaborating with. You have to describe your database. So this is where you have to show that your database qualifies as a pre-existing large database. So you have to describe how it was collected, the data was collected, and to demonstrate that it also is a valid database. There are no bias issues in the data collection process. You obviously have to have the statistical analysis plan. This is the biggest part of the approach, of course, and the list of expenses, item by item, and what kind of costs, what are the predicted costs for each item on your budget. The deadline is April 21, and it's relatively close, but compared to other pre-announced grant opportunities. However, remember, this is a relatively simple application form that we believe if you have developed your research question and your analysis plan, the rest should be fairly easy to write up. And you can apply on REDCap following this link. And if you have any questions, we encourage you to ask us early on. And Lorena Gonzalez is the coordinator of our core, and she will be happy to answer all your application questions. So here I see among the participants one of our past awardees. At least I saw him before. No, Jonathan Hernandez was here. If you would like to share with us your experience.
Yes. Do you hear me?
Yes.
Good afternoon. How are you?
Good. Thank you for joining us today.
Yeah, thank you. Our experience, as you mentioned before, was using the NSDUH survey, which is the survey, National Drug Use Survey. And we used data from 2015 to 2019. And when we were awarded, we actually were able to buy a computer that we need to run the analysis that we were going to perform, and we were able to present the results in different forums like the Alliance annual showcase, as well as the two conventions, one in Scotland and the other one in Argentina. I think it was virtual, that last one. And right now we are currently working on the manuscript feedback that we received from the reviewers. We submitted a manuscript with the results, and we are working with the feedback to resubmit it. And afterwards, I applied for an external funding program, which is Aim Ahead. And I was selected as one of the first cohort participants to continue on studying the same topic or something related with this topic that we propose here. So I think this is a great opportunity for those people who want to start exploring or working with big data sets and apply machine learning procedures. I think this is a great opportunity to start. And it actually will open you the doors for other opportunities like it did for us. That's my opinion, and I'm very grateful to be part of the awardees of this project.
Thank you very much, and that's a great example of the project leading to more research development and advancement in the career of younger investigators. And thank you very much for sharing your experience. Again, most of the projects focus on the analysis to publish or to present in research forums, in conferences. However, applying for external funding afterwards to do your own data collection or find another database to explore more details or to validate your results is also a very good idea, and that's something that we encourage as well. And I would like to welcome Dr. Mary Helen Mays, who is the leader of the bioinformatics core at the Alliance, to greet you. And before I forget, I forgot to mention the grant opportunity budget for this year. Unlike in previous years when we had most of the time the funding was limited to $5,000, this year we will have at least two grants, $8,000 each. So one of them will be focused on N3C database, and the other one could be any other pre-existing database. So Mary Helen, if you're there, please.
Good morning. Yes, good morning. Hello, everyone. As Sona said, my name is Mary Helen Mays, and I lead the biomedical informatics core for the Alliance. We're very happy this year to be able to join forces with BIRD in this very important opportunity. The funding that we're providing really is to focus on the use of the N3C data enclave. If you're not familiar with the enclave, let me just give you a very brief overview. It is an NIH NCATS resource that was developed and put into place shortly after the COVID-19 pandemic began. Currently, it includes, and these are all data that are from electronic health records across the US. In the next couple of months, we're hopeful that Puerto Rico will be also contributing data specifically related to COVID to the enclave. Again, it is COVID specific, but it also covers a vast array of disease and research issues that are related to COVID. For example, within the enclave, there are data on social determinants of health, major disease states such as cardiology, neurology, respiratory. You know, it's vast. If you have additional questions, please reach out to me and I can give you more of an overview on that. But no important. Oh, I'm
So
sorry.
one more additional detail, it doesn't just include COVID positive cases.
Exactly.
It's people who have not been diagnosed with COVID.
Exactly. But there are almost 6 million individuals that are included in the enclave, their data, 326 million procedures, well over 582 million clinical observations, 3 billion with a B lab results. So it's a very vast data repository. There are 3 different levels of data that you can access. The 2 that are going to be most, I think, of interest to this group are the de-identified data, as well as a limited data set. The limited data set goes into more patient-specific identifiable data. You do need IRB approval for that. The de-identified data set, you do not. One of the points about using the enclave is that it is a repository that, unlike, for example, a CMS repository or a CDC repository, you're not able to, as an individual investigator, to just go into the repository, mine data, and extract it out. There is it's a short process. It's not a difficult process of requesting access to the repository. And then the vast majority of investigators will use a data analyst to assist them in going in and working with the enclave data. One of the benefits of this particular pilot project funding opportunity is that we have analysts available that will work with our researchers. So you don't need to really be concerned about going out and identifying an analyst to work with you. We will provide that resource for you. Again, we are real excited about this partnership, and we very much hope that we will have some folks interested in using the enclave. And again, if you have more questions, detailed questions about the enclave, reach out to Lorena, reach out to myself, and be more than happy to speak with you. Thank you.
Thank you. Thank you. And I would like to greet Dr. Omar Khan, who is the PI of the Axel CTR, one of the IDEA CTRs, who kindly agreed to collaborate with us this year and match the projects with senior researchers from their university. Thank you for joining us today.
Thank you so much, Sona. Very much appreciated. I think this is a wonderful opportunity for CTRs across the country to collaborate because we have a lot to learn from each other. And I think if we can demonstrate to our colleagues at the NIH that the CTR program provides exceptional value through this kind of collaboration, you know, the first pilot of this sort is always going to be a little bit interesting. I was thinking about this. The first time we have colleagues from the Alliance CTR and our Delaware CTR collaborate, there will be things to work out. There will be data use agreements. There will be things of that nature. But that'll be really important to start somewhere. So I would encourage folks who are interested to reach out to yourself, to Dr. Rivas, to Mary Helen, to discuss opportunities. And so we can ideally link them with researchers, not just at our CTR in Delaware, but at other CTRs across the country. That would be really important. I did want to just mention a quick clarification. I'm not the PI of the Delaware CTR. I'm the CEO of the Delaware Health Sciences Alliance, which is composed of many of the partners within it. The PI of our CTR is Dr. Greg Hicks, my close colleague, and I've shared this opportunity with him as well. And but our network includes all of the CTR partners within it. And of course, I'm on the steering committee of the CTR as well. So glad to make any connections. And again, thank you so much for setting up this opportunity.
Thank you. Thank you. So I would like to open it to questions from hopefully potential applicants. Do you have any questions? Okay, so if there are no questions, I don't see any hands or.
So just a quick question. What is a typical award that you expect to make in this? I think you mentioned that earlier, but I'm sorry if I missed that.
Yes, previously it was $5,000. However, this year it will be $8,000 for each one of the categories. So we have two categories, one for the projects using N3C database and another one, another $8,000 for any other database projects.
Thank you. And will this presentation be available that you could send to myself and the other CTR leaders, just maybe along with a quick cover sheet that we invite you to apply for this, something like that?
Absolutely, absolutely.
Thank you so much.
Thank you. Thank you for promoting this collaboration among your researchers as well. And so if we don't have any further questions, we prepared a short video and you will be the first ones to see this video, and the link can be shared in other institutions as well.
Donna,
And,
can I make one up? Also for the data analyst, looking at the budget, the right now is going to be provided out of the support that we provide for the analyst currently, so you don't need to worry about figuring that into your budget.
okay. That's an important distinction. So for the projects working with N3C database, you can assume that you will have an analyst already on board to analyze the data, and you don't have to include it in your budget. However, if you're using any other database, you can include a fee for the consultant or data analyst to help you with it. Thank you. And yeah, let's watch the video. Well, thank you. That was the informational part of this webinar. And again, if you have any questions, please don't hesitate to contact us, and we will be able to guide you through the application process and the requirements or any other questions you might have.
Could we look at the chat for a moment? I know there's a question from Ariana Gonzalez. Okay, Ariana, if you're interested in more information on the COVID cohort, again, Lorena, or you can reach out to me directly. My email is Mary, M-A-R-Y, .mays, M-A-Y-S, at upr.edu.
Thank you. Yes, and the again, you can reach out to Lorena and she will guide you if you're trying to find someone else within our alliance.
Exactly. Thank you.
It was last year that we did a webinar on N3C database. So it is listed under the videos on our website, and we can certainly send you the link individually if you're interested in more detail on N3C database. Thank you then. Thank you for coming, and please start working on, if you're thinking of this small grant opportunity, start working on it early so we can help you identify collaborators or answer all your questions and doubts about it. Thank you.
Thank you.